Swallowing and dysphagia exercises, but for the non-medical person. Recently, I posted a video about the most supported and evidence-based swallowing exercises. Today, I want to explain those same exercises, but in plain English, so anyone, patients, families, caregivers, or loved ones, will understand why a speech-language pathologist might have you try them. A quick safety note before we start. These exercises are helpful for many people, but they should only be done after someone has checked that it's safe for you to practice. If you cough on thin liquids, have a very weak cough, or your provider told you not to swallow, stop and ask your speech pathologist or doctor first. Okay, here's a quick, simple explanation of each exercise and why it might be recommended for the non-medical person. Number 1, the effortful swallow. This exercise is simply swallowing harder than usual, like you're trying to swallow a big piece of steak or a big ol' pill. Why this exercise helps? In plain words. Essentially, it gives your throat a stronger push so food and drink move all the way down instead of getting stuck. Think of it like squeezing a tube of toothpaste. You have to squeeze that tube harder to get the paste out. When it's recommended. When someone has food consistently left over in their throat after swallowing, essentially food or liquids are getting stuck, or it feels like pieces are sticking. An effortful swallow might be recommended if someone has a really weak swallow or gets tired really quickly. The effortful swallow is a great exercise to increase endurance of the swallowing muscles. Number 2, tongue pressure training or lingual resistance exercises. These exercises are where you press your tongue up against the roof of your mouth or against a small device. Why these exercises might help. A stronger tongue moves foods better and keeps them from falling back into the throat before you're ready for them. Essentially, these exercises help push food back and help push liquid back with greater control. Imagine the tongue like an engine that pushes the food backward. These exercises make that engine stronger and easier to control. When lingual resistance exercises might be recommended is if someone has trouble chewing, if they have food consistently left over in their mouth after swallowing, if they drool, or if they have difficulty or troubles controlling their tongue movement. These could also be recommended if the tongue gets tired really quickly. If you found this helpful, please save it or share it with a family member or caregiver. Knowing why an exercise is used really makes them easier to stick to and helps with continuity of care and carryover. Comment exercises and I'll send you the show notes so you have all the information.